The coronary circulation is a specialized network of blood vessels that supply blood to the heart muscle or myocardium. It consists of arteries that deliver oxygen-rich blood and veins that remove deoxygenated blood. First, we will discuss about the coronary arteries and then about the coronary veins. The heart has two main arteries. The first one is right coronary artery. It originates from the right aortic sinus and travels along the right atrioventricular groove. It supplies blood to the right atrium, right ventricle, SA node, and AV node. Its branches include sinoatrial nodal branch supplies the sinoatrial node. Right marginal artery supplies the right ventricle. Posterior descending artery or PDA supplies the posterior interventricular septum and adjacent walls. The second main coronary artery is the left coronary artery. It arises from the left aortic sinus and quickly divides into two main branches. Anterior interventricular branch, which is also called left anterior descending or LAD artery, supplies the anterior wall of the left ventricle, anterior interventricular septum, and apex of the heart, often called the widowmaker because blockage here can be life-threatening. Left circumflex artery supplies the lateral and posterior walls of the left ventricle, gives off the left marginal artery. In some individuals, the left circumflex may also supply the SA or AV nodes. Coronary dominance is determined by which artery gives rise to the posterior interventricular artery. Right dominant, which is most common. Posterior interventricular artery originates from right coronary artery. In left dominant, posterior interventricular artery originates from left coronary artery. The coronary sinus is the largest venous structure of the heart. It collects deoxygenated blood from the myocardium and empties into the right atrium. Located in the posterior atrioventricular groove, it receives blood from several veins, which are: great cardiac vein drains the areas supplied by the anterior interventricular artery. Middle cardiac vein drains the posterior interventricular septum. Small cardiac vein drains the right atrium and ventricle, and posterior cardiac vein. The heart also has anterior cardiac veins which directly drain into the right atrium bypassing the coronary sinus, and Thebesian veins, which are small veins that drain directly into the heart chambers, particularly the right atrium and ventricle. Thank you for watching. Don't forget to like, share, and subscribe to my channel for more informative videos. See you in the next lecture.